Welcome back to the Hot Flash Diaries podcast. I'm excited that you're joining us today for episode number 3. In this episode, we're going to cover a few hot topics as it pertains to women in midlife, starting with how do you know if you're in perimenopause or menopause? What is the difference between these two diagnoses and what does that really mean? We're going to chat about hormones, what they are, why they're important, and we're going to get into the nitty-gritty of 3 very important hormones that decline in midlife, specifically estrogen, progesterone, and testosterone. And then lastly, we're going to chat about how these hormones can be replaced in perimenopause and menopause, as well as the differences between bio or body identical hormones and synthetic hormone replacement therapy. Let's start off by discussing what perimenopause and menopause diagnoses entail and how does a woman know whether she is in either phase of her life. So both perimenopause and menopause are marked by the decline of hormones in our bodies. Perimenopause is the beginning of that hormone change, and it can often last about 7 to 10 years. Once a woman has reached her last menstrual cycle, meaning that she has not had any bleeding for a full 12 consecutive months, she is considered to have transitioned into the menopausal phase. So that period leading up to the last menstrual cycle, that 7 to 10 years, is considered the perimenopausal phase. A woman does have to go through, as the medical diagnosis stands currently, 12 consecutive months without any bleeding. Now, there are times when a woman may not have any further bleeding due to either surgery, where perhaps the uterus and or ovaries have been removed, or in the case where an intrauterine device, also known as an IUD, has been inserted. Now, there's many medical reasons as to why either of those procedures or surgeries may be warranted. But medically speaking, once a woman no longer has her periods, she has crossed into that menopausal phase. Now, it can be tricky when an IUD is present, in particular if a woman has had an IUD placed sort of mid perimenopause. It's really difficult to know when she enters into menopause. But when that IUD is taken out and the woman no longer bleeds, then we know that she is in menopause. Perimenopause has often been referred to a period of chaos, and that is a perfect example. It's the time when our endocrine glands, which are glands that produce hormones in our body, are working overtime in an effort to establish balance. So we know that our body likes hormonal balance. It likes that equilibrium. However, in the time of perimenopause, there are so many highs and lows of a ton of different hormones, but specifically estrogen and progesterone and testosterone, that can cause a woman to feel like she is quite literally living in chaos or on a hormonal roller coaster. It can actually be quite similar to that of puberty when there are extreme highs and lows that we see in adolescents and teens as they become accustomed to their monthly cycle. Diagnosing perimenopause is nuanced. There is no question. I have had numerous patients mention that they had blood work done with their previous provider and they were told that they were not in perimenopause based on their lab results. I am here to tell you today that there is no laboratory test or physical examination finding that can confirm or deny perimenopause. Rather, it is what's considered a clinical diagnosis. So this means that the diagnosis is made based on a thorough and careful health history, a family history, and symptom assessment. A provider that is not well versed in midlife changes and symptoms associated with hormone decline and deprivation may not know what questions to ask a woman to determine whether or not perimenopause or menopause is an underlying cause of their symptoms. And of course, as I mentioned in episode 2, not every woman experiences hot flashes, night sweats, vaginal dryness, sort of those cliche symptoms of perimenopause and menopause. But most women do experience some degree of mood changes, fatigue, insomnia, and other symptoms known to be a result of hormone fluctuations. So while it's important to rule out other diagnoses as a cause of the symptoms a woman is feeling, if hormone decline and deprivation is not on the provider's radar, There is a strong likelihood that they are missing the opportunity to have a conversation with their patients about midlife changes, the effect of hormone deprivation, and the treatments available, including hormone replacement therapy. So let's talk about hormones. What the heck are hormones? Why are they important? The word hormone might bring back some memories of high school health class, maybe a few minutes on hormones in the context of puberty, and then we don't hear much more. But in reality, hormones are at the core of almost every single process in our bodies. They are the body's chemical messengers. They are secreted again by these endocrine glands, which are specialized glands like the thyroid, the ovaries, the adrenal gland, the pituitary gland. There are a ton of other endocrine glands in our bodies. So once these hormones are released, these molecules travel through the bloodstream, communicating with cells. They communicate with tissues and organs to guide everything from metabolism and growth to mood and replication or reproduction. So think of hormones as keys that fit into a specific lock on a cell. So each hormone is that key, and it finds its matching lock or receptor on a cell. And once they make contact, it unlocks certain actions based on what the body needs. This mechanism allows the cells to perform crucial functions like boosting metabolism, creating proteins, repairing tissues, and even encouraging cell replication. So they are so important. Surprisingly, men and women share the same set of hormones with over 50 different hormones in the human body, including estrogen, progesterone, and testosterone. So many men are shocked to hear that they have estrogen and progesterone in their bodies, and so many women are shocked to hear that they have testosterone. While we often label estrogen as a female hormone and testosterone as a male hormone, both are vital for everyone, just in different amounts. And these hormones are intricately balanced to work together, a harmony that becomes especially noticeable when their levels start to change with age. So again, referencing back to the perimenopausal chaos, this is when we really start to appreciate hormones and their balance is when all of a sudden there is a deprivation or a decline in hormones. We start to feel not like ourselves and feel unwell. So I was trying to think of a interesting way of presenting exactly what estrogen, progesterone, and testosterone do in the female body. And I was trying to make it fun and exciting, but also have a bit of an analogy so that it would stick. And so here's what I've come up with. To get a better sense of how they work, imagine that estrogen, progesterone, and testosterone are three friends on an unforgettable road trip across what we're going to call today the hormone highway. We're going to start off with estrogen. Estrogen is the planner and playlist master. She is primarily made in the ovaries and adrenal glands. She's the planner of the group. She's got the snacks. She's got the GPS, and she has a perfectly curated playlist. Her presence brings a sense of connection, balance, and direction to the journey. She keeps cholesterol and blood sugar levels in check. She's strengthening our bones and muscles, and she's ensuring that we've got good circulation, as well as she promotes a boost in collagen to make sure that our skin and hair remain healthy. She's also focused on keeping everyone sharp and mentally alert on the trip so that memories and our focus are in top shape and we can enjoy the road trip. So when estrogen is driving, the mood is upbeat, social, and confident. But if she takes the wheel for too long or too little, there may be an emotional detour or two, and sometimes leading to an unexpected pit stop, leaving everyone feeling a bit drained. For women in perimenopause or menopause, declining estrogen levels can be challenging. With less estrogen on the road, the body may experience bone density loss, skin changes, mood swings, or even memory lapses. This is why estrogen's balance is so crucial. Now, progesterone. Secretly my favorite. Progesterone is the steady-handed co-pilot. The calm, steady friend who's all about smooth sailing. Produced in the ovaries and adrenal glands as well, progesterone makes sure that the car runs smoothly and that there's enough fuel for the trip. She doesn't get swept up in the highs and lows, instead focuses on keeping everything balanced, grounded, and comfortable. Think of her as that yoga instructor friend that you didn't know you needed, but you are sure glad that you have as a friend because her presence brings that feeling of calm and well-being. Often underrated, progesterone does much more than simply oppose estrogen to reduce the risk of uterine cancer in women who take estrogen therapy. So long ago, before we could value and understand progesterone, the thought was that progesterone was really only beneficial in women who still had their uterus in place, meaning that they had not had a hysterectomy, and they were put on estrogen therapy. We know that estrogen alone, without progesterone to oppose it, can lead to a proliferation or a growth of the uterine lining, which can lead to uterine cancer. But when we add progesterone in place when estrogen is also being given in a woman with an intact uterus, then we know that it reduces that risk of endometrial cancer substantially. But we know that progesterone now is not just about opposing estrogen. She is critical to menstrual cycle as well as vital during pregnancy, supporting fetal development and helping to prevent pregnancy loss. In midlife, progesterone is the first hormone to decline, leading to anxiety, sleep disturbances, and an increased sense of worry. So stuff that you never used to worry about all of a sudden becomes so worrisome and keeps you up at night. Progesterone's calming influence makes her essential not only for balancing estrogen, but also for bone health, mental peace, and treating symptoms of premenstrual syndrome or PMS. She's truly a natural relaxant, helping to relieve many perimenopausal symptoms by promoting feelings of well-being and enhancing estrogen's beneficial effects. Now let's talk about our third road trip friend, testosterone. She is the thrill seeker. Secreted by the ovaries and adrenal glands as well, she is the friend who loves to test limits, pushing everyone to try new things like taking a few risks. When she's at the wheel, the vibe is energetic, bold, and unstoppable. Testosterone is all about living intensely, building lean muscle mass, boosting libido, and supporting bone strength, mood, and skin health. Testosterone is that gal that can make you feel super sexy even when you're in a pair of yoga pants with a messy bun and a hoodie, or if you're wearing a beautiful fuchsia ball gown walking into a big event. She is the hormone that makes you feel super amazing in your skin. And unfortunately, testosterone often begins to decline before estrogen, especially as we approach menopause. Unfortunately, our current guidelines limit us to using testosterone replacement in women only in the cases of low libido, though we know that it can support so much more. I think there are going to be some changes around the use of testosterone in the coming years, but for now we have some recent innovations like intravaginal DHEA inserts, which are a precursor to testosterone and have shown some significant promising effects for alleviating things like vaginal dryness and boosting libido and sensation in intimacy. So this is super exciting, and there will be a lot more products like this coming to the market soon. Together, estrogen, progesterone, and testosterone make the ultimate road trip team, each taking turns to keep things balanced, dynamic, and harmonious. But if any one of them spends too much time in the driver's seat or not enough time in the driver's seat, that's when things get a little bumpy on the hormone highway. Now, if we had a bigger car, we would have invited 2 other hormone friends along for the road trip because we know just how important they are in maintaining health and overall wellness. These hormones include the thyroid hormone and, of course, insulin. Thyroid hormone is an extremely important hormone that is important for all life stages, and it, of course, is made in the thyroid gland. It is important and vital to our bodies for things like metabolism, growth, and development, and that's why it's important in all life stages. Over 18% of women begin to experience signs and symptoms associated with low thyroid hormone levels as they enter perimenopause. Now, to be clear, this doesn't mean that the thyroid gland is unwell, but rather that it's not producing enough thyroid hormone to maintain optimal levels of thyroid. And this can lead to symptoms like fatigue, weight gain, thin hair, hair loss, and dry skin. This is what is considered in the medical world subclinical hypothyroidism, and it can be easily optimized. This is the one instance where checking labs and checking them frequently is super beneficial because we can test an accurate thyroid level. So this is something that I check quite often in my perimenopausal and menopausal women, as of course the levels can change as we transition further down the perimenopausal road as we get into menopause. Now, the last hormone I'm going to briefly touch upon, and the hormone that I would have invited along the road trip, is insulin. Insulin is a hormone mostly known for its role in sugar metabolism, as it turns glucose or sugar into usable energy in the body, and it is incredibly important in metabolism and weight management. Insulin is one of the most misunderstood hormones, and it plays a critical role in type 2 diabetes. And for anyone that's interested in more information on that, I would strongly encourage you to look up Dr. Jason Fung, who is a Toronto-based University of Toronto trained nephrologist. He has done some incredible research and work around the importance of insulin sensitivity in chronic disease management, and he focuses a lot on type 2 diabetes, utilizing low carbohydrate diets as well as some fasting mechanisms to help boost insulin sensitivity. So he has really done some fascinating work. We are actually going to chat a bit more about insulin in our next episode, where I have the honor of interviewing one of my NP colleagues who is also a hormone specialist in our episode dedicated to polycystic ovarian syndrome, or PCOS, in perimenopause and menopause. Insulin plays a huge role in PCOS, and it is often overlooked, so stay tuned for that next. There are a variety of methods available to replace estrogen, progesterone, and testosterone quite safely. In the cases of estrogen, there are oral tablets, topical gels, creams, as well as patches and vaginal rings that can be prescribed. There are also vaginal inserts or vaginal tablets and creams that can be used for vaginal dryness exclusively. These are preparations that are put directly into the vaginal canal, and they're only absorbed locally, meaning only in the vagina. They are not absorbed systemically. So in cases where perhaps hormones are contraindicated or can't be prescribed, for example, a patient who is actively receiving cancer treatments or has a very strong family history of cancer and who wants to avoid systemic hormones, we are able to use these vaginal inserts or vaginal tablets to help with that dryness. We know that utilizing these types of products can help to reduce the risk of urinary tract infections in women who are in perimenopause, menopause, and of course postmenopause. Progesterone is best replaced as an oral capsule, and it can be taken at bedtime. We know that when it's taken at bedtime through the first pass effect or the digestive effect through the liver, it does cause a sedative effect. So it does help with sleep and relaxation. But there are longer acting sublingual or dissolvable methods that can be used for women who need a bit more progesterone support during the day. But of course, we want to avoid that relaxing effect of the oral progesterone. Testosterone, on the other hand, in women is replaced topically either with a gel or a cream, and oftentimes it can be applied right to the vulva or the external vaginal area, or it can be applied to another part of the skin, sometimes behind the knee or the arm. There are some newer Health Canada and FDA approved vaginal inserts of DHEA, which I mentioned earlier, and this is a building block of testosterone. So once it's put into the vagina and it can be converted into testosterone, it can help a lot with vaginal dryness and also boost libido. But this again is just a vaginal insert. It is not something that's put topically on the skin because it's all localized. In every single method I just reviewed, in terms of the different types of hormone replacement therapy or methods of hormone replacement therapy, there are bio or body identical hormones as well as synthetic hormone options. The difference between these two hormone substances is significant, and it really only refers to the actual chemical structure of the medication. Synthetic hormones and bio or body identical hormones are still made in a lab. They are derived from plants and other extracts, but the difference here is that the chemical structure of the estrogen is identical to the estrogen that we've made our entire lives. The micronized progesterone is identical to the progesterone that we've made our entire lives. So bio and body identical hormones, again, are identical to what we have made, whereas synthetic hormones are not. So they do behave a bit differently. And typically, synthetic hormones is what we oftentimes see in women who are being given contraception. We know that synthetic hormones by way of contraceptive pills can be prescribed to help either stop periods or to regulate menstrual cycles. Bioidentical hormones do not prevent pregnancy, but rather they can support pregnancy and are oftentimes used by OBGYNs in the case of women who are pregnant and they want to support the pregnancy with, again, micronized progesterone, because we just learned about the importance of progesterone in supporting the uterus and supporting the fetal development and just growth of the fetus. So that is the difference. We cannot use bioidentical hormones in contraception. We use synthetic hormones in contraception. And again, their chemical makeup is entirely different. So there is definitely a time and a place for the use of synthetic hormones, but they are select cases such as women who are still menstruating and need birth control, or women who require birth control even though their periods are not regular and they are exposed to the potential of a pregnancy. So again, it's really select cases where women may be put on a synthetic hormone. In general, in my practice, I prefer to use bio or body identical hormones because, again, we know that they're safe and they're what our body has made for many, many years. The goal is, of course, to replenish hormone levels enough so that women can feel well, keep their heart and bones healthy and their brain healthy, and overall just make them feel like themselves again. It's not to replenish hormones to the degree where the hormones that levels that we were making. We want to replenish hormone levels enough so that women can feel well and keep their heart, bones, and brain healthy. We're not trying to replace hormone levels back to what it was like when we were in our late teens, 20s, or even super early 30s. We're really wanting to replace them just enough to support our body and our body processes and also help us feel like ourselves again. Well, that's it for today's episode. Thank you so much for joining. I look forward to seeing you again at our next episode, where I have the great pleasure of interviewing a good friend and colleague, nurse practitioner, Agnes, where we dive deeply into all things polycystic ovarian syndrome, PCOS, in perimenopause and menopause. It is going to be a great episode, so you don't want to miss it. Have the best day, everyone.